It's Wednesday, 25th of March. This is the RCGP COVID-19 vlog number 3. I'm Steve Mole with Martin Marshall, RCGP Chair. The college is producing a suite of practical guidance on our COVID-19 hub, and today's vlog is about our guidance on workload prioritisation. Martin, why was it important for the college to issue this guidance?
Yes, hi Steve. So, we know that there's been a long-term challenge with workload in general practice, and we know that we need to do something radical about that during this COVID crisis, so that we can look after patients who are sick, particularly at a time when we know that our teams are often reduced by self-isolation and by illness. So the college has been working with NHS England and with the BMA in order to produce guidance which essentially says what should we continue doing and what should we stop doing. This is really important so that we can create space to deal with the crisis, particularly as the crisis deepens, so that we can focus on those who've got greatest need, and also so that we can minimise the risk of other non-COVID conditions, that we have to remember they still exist, from getting worse. And we know from previous epidemics that when you focus on an epidemic, other health problems can deteriorate at the same time. Okay, so what does the guidance look like? Well, it's a very simple table, which groups our work into 3 categories. Green category are things that we should carry on doing. The amber category are things that we can do if we've got space to do them at a local level. And the red category are things that we should stop. So as examples, in the green category, we should be continuing to assess people who think they are unwell, making initial assessment. We should be investigating people who have serious illness, particularly cancer, of course. We should absolutely be continuing our immunisations for children and people with long-term conditions. And we should be managing unstable long-term conditions. Of course, all of those, where possible, should be done remotely. In the amber category, we should be doing less of monitoring low-risk medications unless we've got time to do it, and providing care for stable long-term conditions. Again, if we've got time to do it, great, but if they're stable, they're not a top priority. And in the red category, things that we should stop includes managing self-limiting conditions, minor self-limiting conditions, doing things like minor surgery, routine medicals, routine data collection, and of course, not having to engage except in exceptional circumstances with CQC inspections and with appraisal as well. The details of all of these areas are on the college's COVID website. Please remember, of course, this is guidance only. Use your own clinical judgment. We're really keen to have feedback from members about whether this list is right, how we might improve that list, what you're doing at a local level that might be good practice that you want to share. So if you've got any feedback at all, please do so via the COVID email, which is on the website, or by joining the new discussion forum, which has been established by our President, Amanda Howe.
Sounds great. It's a really difficult time for our members at the moment. Are there any silver linings from this piece of work, do you think?
Yeah, I think there are. COVID is a dark, dark cloud, but there are some silver linings, and I guess it's our job as professionals to find those and to make sure that they become a reality in the future when we're beyond this particular crisis. So in the case of workload, for example, there are things that we do, particularly administrative things, that we really don't have to be doing that add little value. So let's really focus on those when the crisis is over and make sure that we don't reintroduce things that are unnecessary. And the other area, of course, particularly around managing self-limiting conditions, patients will learn how to self-care with a little bit of support and help from us, and a lot of support from online resources. Let's encourage and support that and continue that when the COVID crisis is over.
Brilliant. Thanks, Martin. We'll be back soon, and take care out there.